You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein. Today we take a look inside the world of computer-assisted colonoscopy. What is it? How does it work? Is it safe and reliable? Why it's revolutionizing medicine as we know it, and how it's changing people's experiences for the better. So if you're over the age of 40, have a family history of cancer, or would just like to be better informed, this is for you. Stick around, it's going to get interesting.
Welcome to an educational and comprehensive discussion with today's top medical experts. This is your trusted source for the latest in medical news and information. You're watching Medical News Network.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Young, who got some good minutes in the first half, hits the jumper. Tiffany Young, a junior from Hillsboro, Alabama, has 4. Young, 17-footer, got it. And Tiffany Young with a sensational performance.
Welcome back. We're pleased to have in studio today Dr. William Glenn. Dr. Glenn received his degree from the prestigious Johns Hopkins University, his MD from Washington University, and did his radiological residency at Harvard Medical School. Dr. Glenn is a recognized leader and international speaking authority on state-of-the-art CT and MRI imaging. Dr. Glenn is a member of the American Society of Neuroradiology, the Radiological Society of North America, and the American Academy of Orthopedic Surgeons. Dr. Glenn was a pioneer in many of the medical procedures we take for granted today, and is currently at the forefront of the future in colon cancer detection, computer-assisted or virtual colonoscopy. Dr. Glenn, welcome to the show.
Thank you very much.
Okay, I normally ask you to tell me a little about your history and your background, but you were adamant before you would come and do this interview with me that I actually go and have this procedure done. I learned a lot about the procedure, but how many people a year die from colon cancer?
Michael, it's between 55 and 60,000 a year. So it's the equivalent of one 9/11 event every 3 weeks.
How many of those people have to die from colon cancer?
The cure rate, if you know about the precursor polyps, is above 90%. There is a 7% incidence of flat aggressive cancers, but the vast majority, above 90%, if those precursor polyps can be found and removed, those patients are cured.
So 50-some thousand of those people could be cured if they knew that they had the polyps removed. They just never go and get checked?
They don't get checked. It's not a subject that is comfortable to talk about. It's embarrassing. And a lot of their private doctors simply aren't aware of the state-of-the-art of colorectal cancer screening. There are 4 approved insurance reimbursement methods.
Okay, we're going to get into those, and I'm going to have you show me, because we had this discussion, I've actually had 3 of the 4, and now I've had 4 of the 4 done. And I will tell you, it was probably the most humiliating, degrading experience I've ever had. So I would understand why most people don't go and get checked. Before we get into that, there have been some studies out, and I want to talk to you about this because I've done some research. There have been some studies by multiple organizations, some saying that virtual computer-assisted colonoscopy is actually better than where they go in with the scope and they put the thing 6 feet up inside you. And I know you brought a scope today so we could see what that looks like. And then there's those that say it's not the same. And everybody saw Katie Couric go on TV nationally, and we saw her get a virtual one year and a regular scope the next. Why is there this big variance in these reports?
The first 3 major reports of 99, 2000, and 01 were from single slice CT scanners and showed the basic equivalency of a fiber optic and a virtual colonoscopy with a CT scanner above 10 millimeter polyp diameters.
Okay, so you brought some. I know we have a pencil here for you to show me. How big would that polyp be?
The polyps that we're looking for are as big as the number 2 pencil eraser, which is 7 millimeters. That will be the trigger diameter for removing them. We will ignore the ones below 7 millimeters.
Why do you ignore the smaller ones?
Because when you approach 3 millimeters in diameter, you have a 0% chance, nearly 0% chance, of having colon cancer in those polyps. When you get to between 6 millimeters and 9 millimeters, there's about a 1%, 1 in 100 chance that that polyp, that tiny polyp, will have cancer. When you get to 10 millimeters and above, especially above 10 millimeters, 12 to 15 millimeters, the percentage of cancer in those polyps runs between 5 and 10%. So we need to get below 10 millimeters and remove the ones from 7 and above.
How many of them? I know, because talking to people, I know that when they go in with the scope, a lot of times they'll take out 1 or 2 or 3 millimeter polyps.
Not necessary.
But how many of those smaller polyps are normally cancerous?
Almost 0.
So there's really no reason to have them taken out.
That's right.
Okay. Back to the studies. The computer assisted, and I will tell you, the more I read lately, the more that they're saying at 5 or 6 millimeters and above, the computer assisted, the virtual colonoscopy, is actually better at seeing the polyps than the scope.
The breakthrough study came in December of '03. It was the lead article in the New England Journal, and it was done by 3 military hospitals. It was an absolutely brilliant study. So for anyone who thinks that sometimes the military doesn't get it right, they got it really right.
And what did the study show?
The study showed that at polyp diameters of 7 millimeters and above, that the virtual colonoscopy was better than the fiber optic colonoscopy. It was safer, it was cheaper, and it was more thorough. Because the rub is, if you think that the fiber optic is seeing 100% of your colon as the so-called gold standard, it's really only seeing 80%.
Right, because it can't see behind the ridges. And
That's right.
And you're also susceptible, there's no real record of it, to whoever happens to be looking through the tube while they're doing it. If they miss something, there's no way to really go back and re-look.
The fiber optic exams, while they're done on video, are not videotaped. So the operator does not have a chance to recheck himself or herself, give you a copy of the videotape, or share it with a colleague for a second opinion. So most people don't know that.
And the virtual gives you all of that.
Virtual can see upwards of 100% of the colon, and what the radiology people are bending over backwards to do, if you go in for a screening exam, is to hand you a CD of all of the original data so that you have everything.
How many people in the United States every year, right now, how many people are of age or at risk that should be checked?
The number is 60 million, and that includes people with a family history should start being screened at 40 years old.
Does diet have anything to do with it?
Diet, no, but family history does.
Environment?
I don't know the answer to environment. I don't think so. Family history does, a history of colon cancer, ulcerative colitis and inflammatory bowel disease predisposes people to have problems with colon cancer.
All right, we're going to take a quick break. When we come back, we're going to talk about my procedure, what we did. We're going to look at the scopes. We're going to see how it is. And I do want to tell you right, I have never experienced something that was so easy, so painless, and so quick. It was less than 30 seconds they had me on the table taking the x-rays. When I did my other scope, they tried to knock me out completely, and I think I was in there for 2 hours. So we're going to take a quick break. When we come back, we're going to actually look at my personal virtual colonoscopy, and we're going to look at some of the scopes and other devices that are normally used in colonoscopy. We'll be right back.